Let's discover vitamin B12 deficiency, symptoms and remedies. Hi everyone. Today we talk about a topic of great importance for our health, vitamin B12 deficiency, its symptoms, and how to remedy it. But before starting, we want to introduce ourselves. If you don't know us yet or don't know our channel, we are Christian and Michaela, two enthusiasts of natural nutrition and great connoisseurs. We only share our direct knowledge and our experience on this channel. You can follow us when you want by subscribing to the channel. Well, now let's get started. Vitamin B12 is essential for our body. It is necessary for the production of red blood cells and for the functioning of the nervous system. Deficiency of this vitamin can cause a variety of symptoms, which are often underestimated or unrecognized. Let's see what they are. One of the most common symptoms is fatigue. If you always feel tired, it could be a sign of B12 deficiency. Another symptom is muscle weakness. If you have difficulty lifting weights or exercising, this may be a warning sign. B12 deficiency can also cause nervous system changes, such as numbness in the hands and feet, difficulty concentrating, and loss of balance. Other symptoms may include paleness, inflamed tongue, and mouth ulcers. If you have noticed one or more of these symptoms, it is important to get checked out. Fortunately, there are various ways to remedy vitamin B12 deficiency. The first step is a balanced diet. Foods rich in B12 include red meat, fish, eggs, milk and dairy products. For those following a vegetarian or vegan diet, there are also foods fortified with B12, such as cereals. Supplementation can also be a good option. There are many vitamin B12 supplements on the market, but it is always important to consult a doctor before starting therapy. Another option is therapy with vitamin B12 injections. This may be necessary in some cases, especially if the absorption of B12 from food is impaired. Remember, however, that not all people with B12 deficiency symptoms actually have a deficiency. Some symptoms may be caused by other conditions, such as anemia or thyroiditis. So, if you have symptoms of B12 deficiency, it is essential to consult a doctor. He or she will be able to make an accurate diagnosis and recommend the most appropriate treatment. Finally, I would like to underline the importance of a balanced diet and a healthy lifestyle. This is the best way to prevent vitamin B12 deficiency and many other health conditions. Remember, your health is in your hands. Take care of yourself and your body, and don't ignore the signals it sends you. Don't ignore your body's signals and always seek medical advice if you have worrying symptoms. Continue to take care of yourself, eat a balanced diet and maintain a healthy lifestyle. And remember, prevention is always the best cure. Let's now look at the MSD manual, patient version. Vitamin B12 deficiency can occur in vegans who do not take supplements or as a result of an absorption disorder. Anemia develops, causing paleness, weakness, fatigue, and, if severe, shortness of breath and dizziness. A severe deficiency of vitamin B12 can damage nerves, causing tingling or loss of sensation in the hands and feet, muscle weakness, loss of reflexes, difficulty walking, confusion and dementia. The diagnosis of vitamin B12 deficiency is based on blood tests. When you take B12 supplements in high doses, symptoms due to anemia tend to resolve. Symptoms of nerve damage and dementia in older adults may persist. Vitamin B12 form of blood cells, red blood cells, most white blood cells, and platelets are produced in the bone marrow, the soft fatty tissue found in the cavities of bones. Two types of white blood cells, more information, Cobalamin, is necessary for the formation and maturation of red blood cells and for the synthesis of DNA, deoxyribonucleic acid, the genetic material of cells. Vitamin B12 is also necessary for normal nerve function. Meat, especially beef, pork, liver and other offal, eggs, enriched cereals, milk, shellfish, oysters, salmon and tuna are excellent sources of vitamin B12. See also Overview of vitamins. Overview of vitamins. Vitamins are a critical component of a healthy diet. unlike most other vitamins, B12 is stored in considerable quantities, mainly in the liver, until required by the body. If a person stops taking the vitamin, its reserves in the body will take 3 to 5 years to be depleted. Vitamin B12 does not appear to be toxic, however, taking high doses of this vitamin as if it were a panacea is not recommended. Vitamin B12 is present in foods of animal origin. Normally, vitamin B12 is rapidly absorbed in the last part of the small intestine, ileum, leading to the large intestine. However, to be absorbed, the vitamin must bind to intrinsic factor, a protein produced in the stomach. In the absence of intrinsic factor, vitamin B12 passes into the intestine and is excreted in the feces. Vitamin B12 deficiency can cause nerve damage, neuropathy, even in the absence of anemia. Vitamin B12 deficiency can occur in the following cases. The body does not absorb or store enough vitamin. Vitamin B12 deficiency develops in subjects who do not take products of animal origin, vegans, except when they take supplements. Infants breastfed by a vegan mother are at risk of vitamin B12 deficiency. Deficiency due to insufficient intake is unlikely in other individuals. The most common cause of vitamin B12 deficiency is inadequate absorption. The following conditions may result in inadequate absorption. Surgical procedures that remove the part of the small intestine where vitamin B12 is absorbed. The intrinsic factor may be absent because some abnormal antibodies, produced by a hyperactive immune system, attack and destroy the gastric cells producing intrinsic factor, an autoimmune reaction which is called metaplastic atrophic gastritis. Intrinsic factor may also be missing because the part of the stomach where intrinsic factor is produced has been surgically removed. Vitamin B12 deficiency due to the absence of intrinsic factor causes a type of anemia called pernicious anemia. In older adults, absorption may be inadequate due to reduced gastric acidity, which decreases the body's ability to extract vitamin B12 from meat proteins. However, vitamin B12 present in vitamin supplements can continue to be adequately absorbed even by subjects with reduced gastric acidity. Thank you for staying with us until the end of this video. I remind you that if you like this video, you can leave a like and subscribe to the channel by activating the bell to receive notifications of future videos like this one. Thanks and see you soon. Happy integration.